recording before I go any further. A senior research associate in the Department of Community Health Sciences at the University of Calgary and a senior member of Dr. Maria Santana's research team. He has a PhD in political science from the University of Calgary, and his research interests include advancing the craft and science of patient engagement, as well as understanding the patient experience. And Paul is going to be co-presenting today with Brian. And Brian is an active patient research partner with the Alberta SPOR research platform. So I'm going to hand it over to you guys now. Paul, if you want to share your screen.
Sure, yeah. I always enjoy the excitement of sharing screen. Yes, there we go. No, I mean, it's always dangerous when I've seen people share screens with emails on it, and you're like, oh, I'm going to look at their emails just out of curiosity. But yeah, so thanks so much. I mean, I guess my housekeeping note for today is you are joining me from my increasingly chaotic home office. You can see here there's not one, but 3 mattresses currently being stored right behind me. So that is what it looks like. I can explain that later if you're interested. But yeah, so what Brian and I are here to talk to you about today as part of this Attach webinar series is the idea of patient engagement in health research. So our connection is through the Alberta SPOR Support Unit Patient Engagement Platform, which is one of, I guess, currently, depending on exactly how you count, between 4 and 7 of the teams affiliated with Alberta SPOR's Support Unit. The reason why the number is in a little bit of doubt is just because we're transitioning from phase 1 to phase 2, and we're sort of in this weird transitional phase, but certainly going forward there'll be 4 main teams, and patient engagement is one of them. So what Brian and I will be talking to you about today is just sort of trying to introduce this idea of patient-oriented research and patient engagement in health research, just in case you're not familiar with it. A lot of people will have heard about patient-oriented research in general, but if you haven't been as immersed in it, this will be a nice little introduction. We'll talk about what it really means to meaningfully engage patients as research partners. Is really it's only a valuable process essentially if the engagement is meaningful. So we want to talk about really what that quote unquote means, I guess, to all of us. We'll talk about what we are. So like, what is the Alberta SPOR Support Unit? We often get questions about that sort of thing. And it's not just an act of self-promotion, but it's just to sort of situate in your mind how many resources are available out there to advance your own work if you're working in health research, to align it more with the principles of SPOR, the strategy for patient-oriented research. We'll talk a little bit about how various teams might engage patients as research partners, and then just a little instructional guide as to how one might go about requesting services of things like the patient engagement platform. So I'll kick us off, and I'll hand it over to Brian, and then I think I'll play the I'll do the grand finale. So just to start, when we talk about patient engagement and patient-oriented research, a great first question is just to encounter essentially the first word in both of those phrases, patient. So what does it mean to be a patient? Who is a patient? So we do have a video that I'm not going to show you, sort of outlining some of this. The only reason I'm not going to show you is it plays terribly over Zoom sometimes. But luckily lists of words don't do too badly. So who is a patient? So obviously, in the most direct sense, current and former patients, people with current or lived experience with the healthcare system. But it's really not just people receiving or seeking treatment. That's definitely part of it, but it's a broader term when we talk about patient engagement and patient-oriented research. It expands to caregivers and family members who obviously might also have a similar direct kind of experience, but it's even broader than that. It's also the idea of a lot of these patient support groups or patient networks, patient advocacy groups, you know, there's for instance, in Alberta, Imagine Citizens, you might have heard of them. They're a pretty active group, but there really are lots of really engaged, active patient support groups, and we also mean them when we talk about who is a patient. Even more broadly than that, some of the work that we've been doing in Alberta is to broaden it beyond groups that think of themselves as patient groups to really include community groups and organizations. So just as an example, one of the types of groups that we're working more and more with over the last 2 years are newcomer serving agencies. So Immigrant Services Calgary, for instance, which is right down the street from where I'm sitting right now, wouldn't traditionally maybe think of themselves as a patient-oriented research organization. But since we've been in contact with them, we work together on a couple of different health research projects, and the people that they serve as Immigrant Services Calgary have been involved in projects as patient research partners, but also we've been able to connect academic researchers looking for newcomers who might not traditionally be engaged as patient research partners through them as well. So it's really even broader than that. And I mean, honestly, the most broad version of it all is it's essentially everybody counts as a patient for the purposes of patient engagement and patient-oriented research. We used to sort of struggle for examples of how this might actually sort of be kind of operationalize or work in research. But I mean, the pandemic has been a great example of, regardless of whether or not you've personally contracted COVID, members of the public at large have had their health affected in all sorts of different ways just by the existence of COVID in general. So really, it's a broad definition, and we want to be as inclusive as possible when thinking about who is a patient. So now I think I'll hand it over to Brian to talk a little bit about what patient-oriented research is.
All right, thank you, Paul. I do not have any mattresses, so there are no safeguards if I fall off my chair.
Excellent.
As you probably gathered from Kira's introduction, I do not have an academic background. I do not have any medical training. I speak simply from my experience as a patient living with an illness, as a caregiver for someone living with an illness, and as my experience involved in a number of research projects. We have the next slide, Paul, please. So as the slide says, patient-oriented research includes at least one of the following: meaningfully engages patients as partners, focuses on patient-identified priorities, and has the potential to improve patient outcome. The slide says at least one. I would hope that all three are included when we have to qualify as patient-oriented research. And what we're seeing more and more is that CFHI and other funders are looking and expecting to see patient partnerships in their grant applications that are coming forward, and tend to believe that with patient engagement, research is more accountable, more transparent, and more responsive to the needs of patients overall. So we're going to come back to that meaningful. That word's going to pop up throughout the few slides that I have here. And the other word that's going to come up continually is partnership. So we are talking about a difference between partnership and participation. And I've been a participant in a number of research studies, and I've been a partner in some research studies, and a world of difference. So if we can look at the next slide, Paul, we'll talk about meaningful. So meaningful and active collaboration includes governance, priority setting, conducting research, knowledge translation. So what we're talking about is a true collaborative process here. So that's having the partner involved right from the beginning in governance and setting up the structure for the project, priority setting, perhaps even conducting the research itself, and in knowledge translation. So some people, sometimes when we talk to researchers, they're a little alarmed when we use the word partner. And in any partnership, we have senior partners, we have junior partners. It does not mean that the patient partner is going to be able to veto decisions. It simply means that there is a collaborative process whereby everybody's voice is heard, and then you move forward in a consensus basis. And as far as conducting research, that's another one that is kind of, sometimes there's a role for the partner to involve in the research, in many cases, once the process starts, they don't have a direct involvement, but definitely should be involved in, continually involved in updates. One of the research projects I'm involved in right now was involved in the beginning a little bit in the research and contacting some of the participants in the project. Currently, the health officials are going through the screening process. Not something I'm involved in, but I'm there at every biweekly update and meeting and have the opportunity to provide input, and have been asked to come back in and contact some of the participants. It's quite a difference in the conversation, a peer-to-peer conversation that I have with some of the patients, participants, than what the medical professionals have with that. Quite often we'll have a participant maybe a little bit more reluctant and more willing to open up on a peer-to-peer basis. We'll talk about knowledge translation a little bit later. And at the bottom there just talks about, and Paul had mentioned this earlier, about may also bring the collective voice of specific affected communities. So that may be looking by age, by sexual orientation, by income level, or by ethnic background, or so forth. So we want to make sure that we are representative in getting the collective voice of the community. Next slide, Paul. So this one just visualizes that true partnership that's bringing together and merging the learned knowledge, scientific knowledge about a particular illness, and the knowledge living with the disease. And I did a project recently with two other folks who were recipients of heart transplants. You can study cardiology, you can be involved in the surgery, but listening to these two folks talk about what it's like waiting for that recipient to come and having that death literally hanging over your head, understanding the guilt that comes with praying for that heart transplant, knowing that what you're praying for is you're praying that somebody else will die so that you can live. And their experience in going through the surgery itself, the time in the hospital, the physiotherapy afterwards, all of the lifestyle changes that they have to make, and that continual worry hanging over your head about how long is that heart going to last. These are some lived experiences that may come across a little differently than the learned experiences. Next one, Paul. So meaningful, active collaboration. There's a little bit of a framework there, but coming back, we're going to see these 4 words pop up again and again. As I said, involved from the beginning in the governance, priority setting, conducting the research, knowledge translation. That can be getting the word out during or after presenting to patient groups, presenting to community groups, or even presenting back to the funders themselves. And I've been involved in our annual year-end report back to the funders. Maybe Paul will just move on to the next one as well. And this is just a pictogram, which again, just tries to emphasize that the patients are involved in all aspects of the process itself, data collection, analyzing, dissemination. Talking about translation, I recently, we did a year-end study and the term PRN came up. And probably most of you know what PRN stands for. I think it was nata, as required, or if special circumstances arrive. But sometimes it's just the bringing it back to a common language that patients can understand, that patient groups and community groups can understand. And that's a little bit of input that a patient partner can have there as well. And we have one more slide here, Paul. Or 2 more slides, I guess. This is just a representation of John Dewey's model, just saying that that lived experience is the cornerstone of it, and that it's essential to be able to have that understanding what the illness is. I have 4 grown sons. I went through the pregnancy with my wife. We studied it the first time. We went to some classes the first time. I was there for the birth of my children. I think I can quite reasonably say that I understand what it's like to give birth. My wife would laugh in my face and say, I have no idea at all about the intensity of the pain. You can give it a number if you want, but I had no understanding about the intensity of the pain, about the pressure that's felt to push, what it feels like to have your skin tearing, worrying about the head has come out. I know the shoulders are going to be even bigger. There's a huge difference between the lived experience and the learned experience, and we have a little bit more crisper clarity of what the pain is like, what the symptoms are like, and what the ailment is like in general with that lived experience. And I think I have one more slide there, Paul. So again, this is just kind of wrapping up that we're involved right from the beginning, multi-way capacity building, so that we're maximizing the capacity that's brought forward from the learned experience and the lived experience altogether, basing on the knowledge, experience, and hoping that that's going to bring some new insight into some of the work that's being done, make it more relevant to the patients, to the outcomes that are there. And really, it's about creating that successful partnership. I've had some wonderful experience. A little reluctant when you first go into the project. You're sitting in the project with medical doctors, with research scientists, and you wonder, like, how can I possibly help? But I've been welcomed as a partner. My voice has been heard, and I think that I've been able to contribute to the successful outcomes that have been from the projects that I've been involved with. So thank you very much for the opportunity to just share some of my experience. I'd be glad to answer any questions later, and I'll turn it back to Paul.
Thanks so much, Brian. So now what I'm going to do is just lead us through a little bit of kind of some of the infrastructure around patient engagement that exists across Canada, but also Alberta. So obviously, as you might guess from the name, the big strategy associated with patient-oriented research is in fact the strategy for patient-oriented research. So this is SPOR. It's a initiative initially from CIHR. And then what exists around the country are primarily provincial support units. So the Maritimes have combined to make their own amongst the 3 provinces there. So not Newfoundland, obviously. But these SPOR support units are partnerships between, like 50% of the money comes from CIHR, 50% from local partners. So currently right now in Alberta, it's Alberta Innovates. And what this funds is different sort of essentially research teams embedded in Alberta, for instance, either at U of A, U of C, or inside of AHS directly, that provide services to researchers to enable them to conduct patient-oriented research. So what does it mean there? It can be everything from patient engagement to data related to the patient experience, to training and capacity development, and assistance with knowledge translation. So we do have these sort of 4 main focus areas. So the patient engagement platform in red is the team that I'm on. This is led by Dr. Maria Santana, who's based at the University of Calgary in the departments of pediatrics and community health sciences. There's also data and methods. There's capacity development and knowledge translation as other areas of focus. And these are paralleled across the country, so it's not exactly the same, certainly, if you're joining us from outside of Alberta, but certainly this is what exists here. So in Ontario, there's OSU, so the Ontario SPOR Support Unit. There's various ones like this. So we have the Alberta SPOR Support Unit. So this started in either 2014 or 2015, and it's just about to be renewed for another 5 years. So it will be around at least until 2026, I believe. So we do often get questions at this point about eligibility to receive support from these support units. Essentially, the short version is go to absporu.ca, where you can find out all of the information there. But the eligibility criteria is basically directly aligned with the definition of patient-oriented research that Brian talked about a few minutes ago, where if you're in a research setting or a principal investigator, which essentially in Alberta will mean one of the universities, or you're associated with one of the strategic clinical networks, or you have research time as part of your clinical appointment. Like there's various sort of ways that this can exist. It obviously has to be patient oriented, aligned with those 3 definitions. If there's some end user engagement in your project, and then the potential for patient and system impact. And all of these services are currently provided free of charge, and it's certainly the the plan going forward, except for certain very niche services. Like sometimes people have data requests from the data team, which will take so many person hours to complete that sometimes there is some sort of cost recovery there. But beyond that, essentially, it is freely available as part of this grant project. So I'll talk a little bit then now about what people ask us about when they come to us. So essentially our main kind of thing that we do is provide research consultations with teams where we can help kind of help you think through how you might incorporate patient engagement approaches into your research project. So I mean, one way to think about this is to sort of look at any of the versions of the research cycle that you will have seen. I mean they're all slightly different, but essentially the same. So if you think about this version of the research cycle, so planning and preparation, study design, study implementation, data analysis and dissemination, there are ways that patient research partners can be helpful members of your research team at each of these stages. And again, just a reminder, as Brian very nicely said earlier, is a big difference between, at least in this world, of what we might call patient participants and what we might call patient partners, patient research partners, lots of different words for that. So patient participants are almost the more traditional way of patients being involved in a research project, essentially as the subject of study where data is being gathered from them. And that's great. I mean, there's nothing wrong with that, certainly. I mean, it's a main way to conduct health research. But patient research partners are not the subjects of the research. They're not the people from whom you are gathering data. They're the people who are essentially on your research team as patient partners to help guide the process. So very similarly to how you might have a team of, a qualitative researcher and a biostatistician and a clinician and a lab scientist, you will also have a patient research partner just alongside everyone else. So it's really just about the dynamic of where they're positioned in the team. So what can patient research partners do as part of your team then? So in terms of planning and preparation, as Brian said, it's really great, best practice even, to have patient research partners when you're conceptualizing your project. Certainly more and more in Alberta, we're seeing patient research partners being included as co-investigators or knowledge users on CIHR project grants and this sort of thing. They can definitely are great assistance in reviewing your proposal to make sure that essentially, to give a different perspective on the proposal, that there's in more and more calls are not only requiring this, but there will be lay language requirements for various parts of the submission, and patient research partners are certainly, I mean, better at it than we are, really. They can help identify either more patient partners or even give advice about how you might want to set up your recruitment for patient participants. Certainly projects that we've directly been involved in as researchers. There's one a pediatric asthma study, and our parent and child patient research partners have been really great help in terms of advice about how to recruit people at the asthma clinics at Alberta Children's Hospital, for instance, about exactly, not even so much just like what's on the poster, that sort of thing, but like, where do they sit and what kind of information will they be looking at and looking for, and what will be appealing. And certainly we went from struggling to recruit for one part of the project to essentially having too many people recruited by the end of this process. And as I said earlier, being part of the grant application as co-investigators and co-principal investigators, we've seen that a lot of the time. And patient research partners can often provide very compelling letters of support, especially people with lived experience can help to support your argument that your project is worth funding, for instance, because it aligns with some of their personal lived experience. And we've seen lots of teams have success with this. Ooh, that's too many. in terms of study design, then certainly reviewing research tools. I mean, a traditional role here would be, you know, making sure that any surveys going out to patients are understandable to patients in the group that you're seeking out. But it isn't really just that. I mean, they can also ensure that the methods are sensitive to the situations of the research participants in your study. So we've had various studies in oncology, for instance, where it's about, you know, some sort of care intervention, like a phone call or a letter and so on. And certainly patient research partners in those contexts have really been great at, you know, providing researchers with extra insight into some of the sort of more sensitive and emotional implications of these interventions. And as much as academic researchers might try their best to imagine all of the complications, patient research partners' lived experience really makes them the experts in this field. Again, in the study design, recruitment of participants can be really helpful, even directly. So not just about recruiting participant strategy, like that's great, but also in terms of actually recruiting participants. I know there was a study that our team supported a couple of years ago where the PIs were trying to recruit people in clinic, and again with relatively limited success, and they sent a patient research partner to the clinic to recruit people, and that was again a lot more successful in this context. And I mean, it doesn't mean that it's more successful 100% of the time, but at least it provides you with a different sort of way of approaching potential partners. And again, in the study design, patient research partners can help you identify outcomes of interest that are aligned with the interests of patients. Study implementation, again, recruitment material, increasing recruitment, helping with data collection, whether it's especially, I mean, we're seeing more qualitative studies, so interviews of patients are often either co-facilitated or even entirely facilitated by patient research partners and the patients. And that can often increase the comfort of the participants in your study, talking one-on-one in a sort of more peer-to-peer relationship rather than with a member of an academic research team directly. Lots of success as well conducting and facilitating focus groups. There is at the University of Calgary a program called PACER, so the Patient and Community, I always forget this last part, engagement in research, engaged research, one of these. But it's a one-year certificate program offered as a partnership between ourselves and continuing education, where patient research partners basically learn how to conduct focus groups as one of the main outcomes of this training, and certainly over the last 5 or 6 years has been successfully done quite a few times. Once you get to data analysis, patient research partners can play very active and helpful roles in analyzing the data and helping to interpret what the results mean. So maybe break this down between sort of qualitative data and quantitative data. So for qualitative data, interpreting, like theming and interpreting meaning from some of like the interview text, patient research partners have certainly done a lot of work in that area. Coding responses and so on. But then also for quantitative research, sometimes people say, oh, like, does that mean that they have to run the logistic regression for our team? I mean, not necessarily, but what it does mean is they can help interpret what the results actually mean and what the implications might be, especially from a patient perspective. And again, similarly to how you would have a team meeting with the biostatistician and the PI and a research assistant, just to give their perspectives on what the results might mean, patient research partners can often be valuable members of that discussion as well. And then finally, at least in this version of the circle, we get to dissemination, and patient research partners definitely really effective at making sure that the content of the dissemination is presented in a way that's informative and accessible and appropriate for a broad audience. Patient advocacy groups that we talked a little bit about at the beginning, especially if they become aware of the results of the research, can often be really powerful advocates for the uptake of research projects into the local health system. Certainly seen lots of examples through our team and other teams across Alberta of patient research partners co-presenting papers that they've been working on at academic conferences. It really provides a different and I think really helpful energy at the presentation, just to provide this sort of multiple perspectives. Of course, outside of presentations, patient research partners, there's quite a few in Alberta who are active co-authors on an assortment of peer-reviewed publications as well, not just in terms of reviewing the papers just to look for general acceptability, but even writing sections of the paper from the patient partner perspective. So once we get to this part of the discussion, a common question that I'll maybe pre-anticipate is, what about research ethics board approval and ethics approval? So depending on where you are, it can be a little bit different, but it's not a barrier to pursuing patient engagement approaches in your project. So at least at the University of Calgary, for instance, we've had lots of discussions with the research ethics board about this in general. And when patients are working as patient research partners, especially early on in the project, sometimes people worry, do I need to get ethics approval for the project before I've even designed the study to engage patients as partners? And the answer is essentially no. As long as you're not gathering data that you're using for publication from your patient partners, which I mean would make them more along the lines of participants rather than partners, they are just members of the research team. So it's similarly to how you don't need ethics approval to add the biostatistician to your team. You don't need it for patient partners. Again, with the line being, if you're not gathering data from them as partners. And again, they can patient research partners can be listed as members of the team even inside the ethics application, and that generally is not too much of a problem. Obviously, there's sort of the vagaries of exactly which ethics reviewer do you get and what's their current understanding of this sort of research. But in general, we're finding more and more, certainly, at least directly at the UC where I'm based, it's not a controversial addition at all anymore. It was about 5 years ago, but now not so much. Another question is basically, how much does this kind of work cost? So obviously there, like even outside of the of direct financial costs, there is a little bit more time sometimes set up to set up these things, especially if you've not worked in this way before. It's just about, like, working in a thoughtful way about how to engage patient partners meaningfully. As Brian talked about, can require a little bit more time. But I mean, my general bit of advice to researchers is not like research is always a very fast process anyway. So this is not a new roadblock that's stopping the research. But there are some direct costs as well. So certainly there's the idea of reimbursement, which is just covering direct costs and expenses associating with participating in research projects as partners. So I mean, things like travel, parking, childcare, maybe there's lunch, this sort of thing. So I mean these things are generally not terribly expensive anyways, but you can build them into CIHR project grant applications, and they seem to go through like that. That's never the reason why a grant would be rejected. I mean, right now is almost in some ways the cheapest time to do patient engagement and research, just because of Zoom and so on. So like, we haven't ordered as many sandwiches for projects that we've been involved in. But again, you just want to make sure that it's not a barrier to participation to have to cover your own expenses to be a partner. But there's also the idea of compensation. So if you think of the concept that both Brian and I have tried to introduce here of patient research partners as partners rather than participants, they are members of the research team, again, similar to other members of the research team, with their own expertise that they're bringing. So often as a recognition of their efforts, more and more research teams are providing compensation for patient research partners. there can be various ways of doing this for shorter term engagement. Sometimes it's things like gift cards, or sometimes kind of in-kind contributions like conference travel if you're co-presenting and so on. But more and more people are they're using like various benchmarks to build this into your budget. So Alberta SPOR, at least for projects that we're directly involved in, so this is not mandated across the province or anything, we do pay our patient research partners $25 an hour, which was a number arrived at as part of a sort of a broader consensus process done a couple of years ago. But again, opting out of payment should be an option. It's just about having a conversation with patient research partners on your project. Sometimes people just don't want to be paid for various reasons, and that's also fine. And you might consider diversity of protocols, especially when engaging with Indigenous communities. Sometimes other culturally relevant protocols might be more appropriate than essentially payment or compensation. And again, the general philosophy here is just have a conversation about it before embarking on a partnership with a patient research partner, and you can definitely come to some sort of an agreement. And again, building this into your philosophy of a project allows you to put it in your budget when you're applying for grants, and it's really I've never seen it be a barrier for a grant before. What about the question of how many patients do you need to engage as patient research partners? So essentially, I'll provide the true but not very specific answer of there is no ideal number. 3 is not better than 5. 12 is not better than 6. You know, it really depends on the project and how long it's going to be and what you need patient research partners to do and what skills and lived experience they bring. So we have one project where there are 2 patient research partners. There's another where there are 6 pairs of parents and their children as patient research partners. So there's 12 on another one. So it really just depends on what you're doing. Relying on one patient partner can be somewhat problematic for various reasons. I mean, it doesn't necessarily bring a diversity of perspectives to the team. It can sort of overburden them sometimes. If they can't make a meeting, then there's no perspective from a patient research partner. So I would say a few is good, but beyond that, you just have to, again, think about what you need. So if you need a diversity of backgrounds and perspectives, you might want to have more patient research partners. But if you're looking for maybe a narrower range of lived experiences, it doesn't necessarily have to be as much. But again, it will depend on your project. And the last point I'll make here is that oftentimes there's sort of a method of convenience for finding patient research partners, which is definitely fine, but it can lead to not necessarily including patients that are not traditionally engaged in health research. So just being thoughtful again about who you want to recruit. It might require reaching out to community organizations rather than just posting a thing at a clinic on a clinic board. So again, just thinking about how to do it is the right way. And again, remembering as well that tokenism is not patient engagement. Having 3 patient research partners just to tick a box off on the CIHR grant will allow you to tick off the box in the CIHR grant, but it doesn't mean that you're actually doing meaningful patient engagement. Maybe I'll skip over this one just to let us get to questions. It was just an example of another project that I've essentially talked about. But the final point I'll make here is that if especially you're encountering these sorts of thoughts and ideas about using patient engagement approaches in your research project, for the first time, know that you're not alone. Know that various SPOR-aligned groups are here to support you, especially the support units. And you don't have to encounter this again for the first time. So for instance, the kind of things that our patient engagement platform does for research teams across Alberta is helping you to develop a patient engagement plan. So if you're doing it straight from the first time, you might need a budget, you might need a strategy, you might need an outreach plan. A big thing that we do is help connect you with potential patient research partners for your project. So we can do postings for your project and reach out either through some of our more traditional kind of, basically we have email lists and so on, but also we can reach out to community organizations that we have connections with if that's necessary, or we're basically a matchmaking service if you want, for potential patient research partners and academic researchers. We can also mentor and coach, especially newer patient research partners on your team through the process of becoming a patient research partner. We train teams as well on how to think about patient engagement. So there's lots of different things you can do. Again, you can go to appsporu.ca. Essentially, there's a PDF that you fill in and then email, which I'll admit is a slightly strange process, I think, in my opinion, but it's definitely okay. Also on our website, you can go to, again, appsporu.ca. I sound like a salesman here. You can, we have how-to guides from both a researcher and patient partner perspective. We have developed some ethical considerations for patient engagement. So not just the formal ethics process, but also other ethical considerations that you might think about before starting this. We have various terms of reference documents in case you want to do that. We have our patient partner appreciation guidelines, which is sort of helps you think about issues around compensation and reimbursement. Cost calculators for budgets, if you're putting together a budget for this sort of thing. Considerations for co-authorship for patient partners, like how does that work? Sometimes people have questions. Lots of resources around the evaluation of your patient engagement process as well, which is sort of a growing area of the practice and science of patient engagement. So again, here's the website. We have circled where you have to click. I think it's a little bit confusing, but I'm not in charge of the website. You have to click on this data and services tab, and then it will take you through to the service request form at the bottom of that page, which allows you to get in contact. Another resource that does exist as well is PACER, this Patient and Community Engagement Research Program. So this is especially appropriate for sort of larger projects, or like, multi-year projects where you need patient engagement at sort of at a level that requires maybe more training. And this is a program that we sort of co-facilitate with Continuing Ed at the University of Calgary. So it is another way for patient research partners to get trained. So you can find out more about that as well on the website. And we have lots of other things as well. A surprisingly popular one, especially during times of COVID, has been our Patient Engagement Journal Club. We actually have people from around Canada, basic scientists from Memorial University and some healthcare staff in BC join us every month, and we talk about different journal articles that use patient engagement approaches. We usually have either an author or someone else present a paper, sort of traditionally like a journal club is, and then we have a good discussion about the paper and the methods and some of the patient engagement processes used in the paper. And we get a really good mix of sort of more traditional academic researchers as well as patient research partners. So if you have questions, we at least hopefully have answers. So we do have this Gmail, because we don't have a Group U Calgary account yet, but you can email us at peplatform@gmail.com, or you can find us through appsporu.ca. So I think that's, yeah, so then here are some logos that you can look at if you want. So I'd be happy now for Brian and I to entertain questions. I think Kara was gonna maybe run the questions for us.
Yes, sorry, I just needed to unmute myself. Thank you so much for that talk, Paul and Brian. We have a few questions here. I'm just going to scroll to the top and work my way down. Okay, so our first question is from Malcolm King. And can a patient partner subsequently become a research subject?
Yeah, so I mean, Brian, certainly jump in whenever you wish, but otherwise I'm happy to talk. Yeah, so in general, we recommend, at least for the same study, not to do so. I mean, I mean, conflict of interest is almost the right, I see a comment there, is almost sort of the right concept, but it's generally better to sort of separate the roles. So you will want patient research partners with lived experience of whatever area your research topic is, generally speaking. But advising and then participating in the same project can be sometimes just sort of unusual, and it can often raise eyebrows with the ethics board as well. So I generally recommend separating out the roles. I mean, it doesn't mean that they can't have been participants in other projects or future projects, but maybe projects where they're partnering might distinguish between them.
Okay, thank you. So the next question, and I think this is related to the COVID topic. As certain groups are identified as having higher COVID rates due to many reasons like language barriers, etc., did either of you engage with any of the identified community groups? And if so, how did SPOR work with those groups, and were there any conclusions?
Yeah, it's a good question. Yeah, I mean, certainly through COVID, there have been projects either essentially affected by just the existence of the pandemic, or even eventually directly about COVID. And certainly, there's an interesting project which is complicated for various reasons, so I'll be a little bit vague about it, where our role was to help recruit patient partners from certain ethnocultural communities in Southern Alberta. And certainly the way that we did it was basically just via community groups. But I don't know if any of the projects that we've been involved in have come to any conclusion yet, I guess.
I have a follow-up question from Susanna's question, and again, I'm jumping the line because I'm running this. So one of my questions that has popped up that keeps on popping up is that I have, for example, a COVID study that we got off the ground like pretty quickly after the pandemic started, but it happened so quickly that there wasn't really much opportunity for me to reach out to a SPOR group and ask about patient engagement. And even at the time, it would never have occurred to me that because I was thinking about a general Canadian population that I could still reach out to a SPOR group, that they're still general. So what kind of recommendations do you have for those sorts of situations where, how you think about dealing with, general questions, not patient population specific questions, or when it's like, I have an opportunity like right now, we need to jump. Like, what are your guys' recommendations for those?
Yeah, I mean, I guess I've seen it work a couple of different ways. Certainly, I would say it's never too late. That's the first thing I'll say, is if you find yourself having taken some steps, it doesn't mean that, oh, it's too late, I can't engage patients in my research project anymore. Like, definitely not. But I mean, I would say some project where we've seen that kind of work well is if your group or research team has active relationships existing with patient research partners, that can be a way to sort of cut out, I guess, the time of finding somebody. So certainly I've seen more and more kind of, larger research teams having patient research partners actively engaged just throughout, even if there's not really an active research project. So that can be another way, but definitely I would say we do, in my head, I guess I refer to them as patient engagement emergencies, where people will contact us, and we often can find, at least through like our group's existence, we actively engage people across the province. So if you do need to find someone in a hurry, we can sometimes make that happen. Okay, so good habits, and sometimes emergencies can be dealt with. Okay, good to know. Good to know. All right, so the next question is from Matt Mayer. Are patient research partners always recruited from within the study population? I.e., do they need to meet study inclusion criteria? And what happens in scenarios where the disease being studied is a rare disease? Yeah, I'm wondering, Brian, if you have any thoughts about this question here.
You'd have more experience with it than I, Paul, but not primarily essential to be in this in that illness category. I'm involved in one project where I'm in the right demographic, but I do not suffer from those illness conditions. But because I'm in the right demographic and because I have some experience with patient research projects in the past. I was invited to join, and I can speak not on a person with the same illness, but more as a peer because of the age demographic that I work within, and because I can translate the information that they're looking for from the study into something that's non-threatening and easier to converse with the participants.
Yeah, I don't think I'd say anything different. Yeah.
Thank you. And I think this is another follow-up question for Brian, probably. This is from Simone. So how do you, or how did you get involved with being I assume being a patient researcher, being involved with the sport?
I guess I got involved in health advocacy quite a while back. I lost my wife to cancer, and got involved in a palliative care coordinating committee and just with our local health region, and was more involved in sort of the health advocacy role. My first actual research project was to do with health promotion among seniors and peer-to-peer delivery of information. So it was non-specific. And through that project, I was able to co-present at a ASPRU summer conference, and got connected there. And my name got passed on through one of the previous physicians from the initial research project I was involved in, and through some contacts at SPOR. And since then, I haven't had to look for an opportunity, I guess. They've come to me.
And just as a follow-up question, and this can be for Brian and Paul, if someone did have lived experience and they were like, this is something that I really want to do, I want to contribute this, are there networks or websites, or I think I'm answering my own question here, but just as a reminder, where should we be sending people?
Yeah, so I'd say there are definitely various places. So we do have an online network where people can sign up. If you Google Albertans for Health Research, the URL will come up. I would normally say go to albertansforhealthresearch.ca, but it's not working right now. So just Google it and it will come up. It's a better impact site where you can sign up to receive information about various studies. Is probably the easiest way to sort of dip your toe in, I suppose. But I mean, ways that we've seen people get involved as well is just by joining various patient advocacy or patient network groups. And certainly we trickle through those as well. And any other thoughts, Brian, about it?
I was just going to say, Paul, maybe you could mention at the last Journal Club meeting, Sandra talked about the new link up that we're trying to get established. So we're setting up going to be sending out very shortly welcomes to come to a town hall, I guess, where we're inviting people who have experience as patient partners or have experience have lived experience and would like to know more about health research and patient involvement. And we're hoping to bring that group together to co-create a bit of a working network where people can come and share ideas, they can learn ideas, they can learn about opportunities, and it's pretty much open to everyone.
Yeah, I'd say it's sort of almost it's a more exciting version of getting on an email list where we'll have these monthly meetings, which are just sort of more kind of, well, it depends. I guess it depends on exactly the outcome of the co-creation process, but it'll be kind of a more welcoming, maybe less formal version of a monthly meetup sort of approach to learning about these sort of opportunities.
And sorry, is that available on the website, or where, if someone's interested, how do they find that information?
Yeah, so it will be posted on absporu.ca. You can follow us on Twitter as well, and Facebook. So.
Okay. All right. And so one more question. This is from, it moved, Anna McKinnon. So she says, thanks sharing, Paul and Brian. I was wondering where focus groups on material development, like therapy manuals or app buildings, would fall in terms of participants versus partners. It would be collecting information and would likely be included in the methods section of the manuscript, but not clearly data collection that would be analyzed.
Yeah, no, I mean, it's a good question. I mean, the line isn't always incredibly clear, I suppose, but I mean, if you're thinking about it from the perspective of ethics, I mean, this might stray a little bit into the data collection, especially if it's sort of incorporating specific, like if there's a survey associated with what do you think of this. But if it's a co-created process where you're co-creating these materials, then it can be more sort of towards the sort of partnership approach as well. So it is a little bit depends on how you weave the work into it.
Okay. Well, I think that's, I have lots of thank yous in the comments and appreciate the presentation. But we're 2 minutes to the end of the hour. So unless there's any more burning questions, I think we're going to call that a presentation. Any more burning questions? More thank yous? We can always, Paul, are you okay with people contacting you if there's any more questions that come up?
Yeah, no, absolutely. I mean, I think if you find the video, the general email is there. I'm pretty easy to Google. You can find my email that way. I'll put it in the chat as well in case you're.
Okay. Okay. Thank you. There we go. All right. Well, we're going to call it a session then. So thank you everyone for coming. We really appreciate it, and virtual applause for both of our speakers. Thanks very much, Paul and Brian, for sharing. And yeah, so we'll have our next session in a month, the last Friday of March. And you'll be getting poster information and registration link closer to. All right.
Thank you.
Okay. Thank you,
Thanks,
everyone.
everybody.
Bye.
Have a nice afternoon.
Bye.